Our first important topic is what to consider when deciding if a patient can go home and use home mechanical ventilation, or HMV. It starts with a very basic requirement.
The first thing is that the child has to have a medically stable condition. That is, the lung disease or the disorder can't be changing minute to minute so that one requires changes in blood gases or changes in the ventilator or very careful monitoring as would occur in an ICU.
So if the child has a medically stable condition, the process of considering HMV can begin. Naturally, the process can vary from hospital to hospital, but here's how the healthcare teams work with families at Children's Hospital Los Angeles. It starts with the initial conference.
We'll get with the social workers, the doctors that have been caring for them, any other ancillary practitioners that have been working with the family, and try to organize everyone to come together to kind of give all information all at once so that we know that everyone's heard the same information.
The first thing the healthcare team wants to know is if the family clearly understands and accepts their child's diagnosis and prognosis.
We can't get to acceptance unless there is truly understanding. And so there's to get the denial piece out, we have to really make sure they got their head around what's going on with this kid and what's expected to go on.
Needs to be educated about the fact that a ventilator will be required and all of the things that go along with that.
We just try to get an idea of what they perceive at that point and where we need to go from there.
And one of the next places to go is looking at whether the family is emotionally prepared to take their child home. There are certain attitudes that point to success.
I would say that they are of the attitude that this is my baby and this is what I was, given. There's a spiritual piece to it, that they feel like this is the task at hand and I'm taking it.
It took a lot of thinking, and we actually met a lot of parents who had children with kids on ventilators and how they adapted to living that way at home. Seeing what the other parents went through and how amazingly they were doing so great and how they love their children and they were willing to do that, I said, I can do this for my son. We can do it.
Most of the parents with tracheostomy children, once they really decide that this is what they want for their child, they have the willingness, not just the love and care that they provide for their children, but they have the willingness and they really they're motivated to learn and they want to give the best care for this child. And they ultimately reach the goal that, hey, I can take my child home and I can be at home with my child and be able to do all the things that we never used to do. My child can go to the school now. Parents can move on to their job. They can take a little short vacation with their children and they live as normal life as possible. So those are, I think, the best things that ever happens to these parents. And taking care of their child independently, I think, is one of the best reward that they will ever have.
And most families that are willing can get the training they need to take their child home. There are other considerations to discuss at the initial conference, including what kind of family support is available.
They do need to have family support. There needs to be at least one other caregiver in the home in the event that the parent gets sick, for example, and can't even take care of him or herself. Someone else needs to be available to do that.
And it's not just physical support that's needed from the family, but emotional support too.
If mom and dad are fine, but grandma's not fine, and grandma's the matriarch of the family, we have to bring grandma in. We have to make sure what grandma understands. We have to look at the whole constellation of the family that's part of the support system and really make sure everyone's on the same page.
We've always been a very close family, and I just think it makes it easier when you have the support of family and friends.
Yeah, we had fabulous parents, grandparents help, and some friends that were remarkable. So Jimmy always had someone bedside with him 24 hours a day.
And we really have to support the idea that mom, dad, and whoever they acknowledge as a family is part of our team so that we can build that team trust and work as a team for the betterment of the child. So I guess the family constellation in its entirety is really the biggest piece for me.
And when the family and the healthcare team agree that home ventilator care is the best thing for the child, then the real preparation begins. Coming up in the next chapter, training at the hospital and at home.